First of all, I would like to say thank you to Dr. Pira Khan and the whole team for arranging this wonderful kind of workshop and conference and gave us the opportunity to interact with you on this forum. And I have just learned from the very first session from Faizan that there are many students are sitting in here. So actually my topic today is, if they can just put the presentation on here. The presentation thing, why? What happened was that there was a little mishap because myself and Asif Bhai said that he will be coming before me. So I was expecting that Asif Bhai don't mind because it's just a matter of just coming forward and just slightly backward. So I'm sorry about that. But anyway, coming back to the topic, we try to wind this up very quickly. The topic is very huge, and they have gave me the sort of opportunity today just to talk to you about this topic. How many people in this room have heard about this thing before? के टेपिंग कितने लोगों ने किया है, पहले सुना है आपने? ठीक है. So the K tape is a kind of method. It's a kind of method where you apply this tape and assume that it will encourage the recovery, and it has been used mostly in sports injuries and other musculoskeletal problems. It has been also used in stroke rehabilitation. So there is evidence that it encourages the limb movement, and as Faizan was talking about the stroke rehab thing. So if you put the tape on in a certain direction, it can improve your function, because all we are here to improve patient function, right? So if you just consider this. The other thing, they have used this tape with the kids with neuro problems like cerebral palsy. If they are unable to hold their head up, like if they are in a poor posture, so you can put some tape on, and that encourages the postural rehabilitation. You can also do it for the trunk muscle activity, just to activate the trunk muscles. So it has quite a bit of use. It has been also used to reduce the swelling. So if you have a swelling in the ankle, the wrist, or any part of the body, or people who have mastectomies in women, and they have this lymph node drainage problem, so that will help to reduce that swelling. This topic is quite big actually, because when we conduct the workshop, we just try to do it in one day. If you do it in one day, it takes from 9 o'clock in the morning at least until 4 or 5 o'clock, with a lot of hands-on practices and theory and everything. But what I will do today, I will just introduce you to this concept, because the audience is quite new, and it will be helpful, I think, just if you can introduce them to this concept. So when they go towards their graduation in their final year, how many people are in final year here? Final year, raise your hands please. Fourth year? Third year? Yeah, so it is a mixture of people. So you people will be graduating fairly soon. So you can think about these kind of gadgets. Because what happens is, if you do a workshop, what tend to happen is you treat everybody with care taping. If you go to mobilization, you mobilize for everything. If you go to an exercise therapy or intervention workshop, so it's all good to have all these things, and then you should be able to differentiate between the treatment options is available to you. Okay, so that's the must thing. But whenever you apply this tape, there is always a lot of reasoning behind it. So it's not like shoulder patient and we will put the tape on. Thank you. So this person, Kinesio Case, he invented this wonderful thing, and initially it has been used for patients with neurological pain, patients who have musculoskeletal pain, neurological pain. How many people have seen patients with tape on? देखा है किसी को नी में टेप लगा हो या शोल्डर में, देखा आप लोगों ने स्टूडेंट्स? ठीक है ना? So it influences the muscles through the skin input. So what happens is it just work on the skin and produce a lot of effects. So whenever we try to do any intervention, the first thing that comes into our mind as a physio, how does it work? Okay? It's very important to recognize that how it works, because we will not just put the tape on and hope for the best. So we need to understand the basic concepts behind the tape. If you put the tape on in the wrong direction, it may make the problem even worse. Okay, so all we should be doing with a correct logic, clinical reasoning, proper assessment, and then choosing this technique for the patient. So it was used to be a conventional taping where you put the conventional tape on, the one which conventional tape means the tape doesn't have any stretching capacity. So you put a conventional tape on somebody's shoulder or knee. So what tends to happen, it decreases your mobility because it restricts your joint. So if you put a tape on from the anterior shoulder, then you can't go to further extension because it limits your activity. So that is the difference between the K tape and the conventional tape. But with the K tape is elastic. You can pull it. It has some elasticity. So if you put the tape on, you can actually do all sort of exercises with it. So it encourages the activity in the right direction of the movement. So that's how it's different. It is stretchable, but the conventional tape was not stretchable. You will still see the conventional tape being applied to acute sports injuries, like when you have to immobilize somebody's ankle or wrist and you don't want the movement on. So what you can do, you can put the conventional tape, what is available to you on. But then later on, if you want to exercise them, if you want a recovery, then you should be able to do the kinesiology taping. So that is the main difference between the two. The other thing is, the K tape is made from cotton. So what happens is, if you put a tape on somebody, it allows air circulation to the pores. So you don't have any skin problems. And in my clinical practice, what I've observed that this tape is quite safe. It doesn't have any allergic reactions, because if you put a plaster like a sunny plus, if you have a little cut, you put a sunny plus, and next day you see there is some reaction to it under the skin, and then you can see that the area is quite sort of different color, or it's white or yellow, whatever. So what happens, sometimes you can have a lot of itching on it. So what happens is you have a allergy to the sticking material. Okay, but this kind of tape is less allergic and quite safe, and you can use it quite usually. And like I said before, the full range of movement will remain. You can still do a lot of exercises. We will show you that in a minute, and then you can apply this tape in a proper rehab setting. Right, so like we said, how does it work? So actually, the pathophysiology of it lifts the skin. If you put a tape on, it lifts the skin and it allows you a lot of blood flow in the vessels, in the limbs, and it take more nutrients towards the area, clears some of the waste product and it improves your healing through a lifting technique. So that's how it works. And you can use that in tissue repair, or if something is damaged, it is quite useful to use this kind of modality. And so basically we have done all this TENS machine, short-wave diathermy. It all allows you to improve blood nutrients, right, cause erythema to the area. So you will be surprised if you put the tape on, it can still cause you erythema, increase blood flow in the area and promote healing. That's how it works. This is the quick example of it. So if you look at the picture on the left side, from your left side, you have a skin. If the skin is tight, what happens is it compresses the fascia. And when the fascia is compressed, it compresses your blood vessels and also lymph vessels, and also on the other side there is an inflamed tissue inside, which also put a pressure, upward pressure, and then you have all this problem coming on. The pain receptor has been compressed, that causes more pain, and inflamed muscles on the other hand, and then compressed lymph. This doesn't work, otherwise I could have shown you. But on the right hand side, if you think about this side, the right side, if you put the tape on, what happens is it lifts the skin and it uncompresses the receptors, it dilates, increase the diameter of the vessels, and also the lymph node will be dilated, and it reduces the compression on the inflamed muscles. So with lifting the skin, you can actually create more space for the blood, for the pain receptors to allow more circulation to the area, and then increase the healing process. So that is the only, because like I said, whenever we do any technique, we need to say that how does it work. There should be some kind of pathophysiology behind it. So that is the only thing we can produce for K-taping. You can use this for physiological or neurological pain or musculoskeletal pain, and it says it relieves the pressure on the pain receptors, so that allows more healing. If you think about it, how does it work? So tell me, if you have a poor posture, yes, if you can slide, if you can just sit forward, everybody, just slide, sit forward, आगे झुक के बैठे ऐसे करके, झुक के बैठे, and then you raise your arm up. Can you do the movement properly? If you can now, correct? Yes, you can do the movement. So what happens is, if you have a poor kind of anatomy or biomechanical something wrong, then the movement is difficult. So what you can do, you can, with a tape, you can correct the alignment, and then that will help you to perform the exercises in the right position. Or say if somebody have a subluxed shoulder, the shoulder is dislocated or subluxed posteriorly or inferiorly or anteriorly, whatever, if you put that shoulder back in the place with a tape, that allow you more movement and movement in the right direction. So you can always use it for anatomical support. And also, like I said, if you do the exercise in the wrong direction, that even damages your tendon or your structures more. Like say, if you do these exercises in this direction, it does cause you more impingement, right? So what will be happening with the tape? First of all, like I said, always assessment. If you've done the right assessment, then if you understand the concept, then you should be able to apply this tape to any kind of problem. Okay, so just if you can just concentrate, give me 10 minutes just for this session, and then if you can go through this concept, see how you apply this tape. If you know the correct concept, then it's not difficult for you to apply to any area. They also said if you have a poor alignment, then you have a poor joint proprioception. So with correcting the alignment, you can increase somebody's positional sense. Because what happens is normally our positional sense since our childhood, we have been developed in one position. Come after injury or after poor posture or to any problem to your musculoskeletal, you have a poor positioning, and then you have a poor, because of the poor positioning, your joints will be slightly misaligned, and that will cause you poor proprioception. So what happens, the tape will also correct the proprioceptive input. So if you have the right proprioceptive input, then the movement always going to be meaningful, right? If you don't have the good like say, what proprioception mean is, like say, if I close my eyes, and then if I raise my arms, if I know my arm is on the side, if I can recognize it's now in the back, it's now in 90-degree flexion, it's now up, and it's now there, it is now rotated, whatever. So if you can close your eyes and you can sense where is your joint. So what happens is, if you have a good proprioception, the chances are that your recovery will be fast. But if you don't have, a lot of people with even the stroke we were talking about, what happens is we lose our proprioception. So there are some strategies which you can use to improve your proprioception that will allow you your rehabilitation process to be more robust. So that's all you can use. So just, and it also allows you the other joint muscles. So what happens is, there may be some multiple problems. First, you can say if you have poor scapular control, and then if you don't have then shoulder flexion, if you correct the scapula, that will allow you more flexion. So by correcting one side, you can also correct on the other side of the body as well. So like again, assessment. So how to apply this tape? That's the thing, isn't it? Because we said this is a good thing, it is good for practice, it does all this and that. But then how do we apply? Right? So there are, if you go on this side, so if you are treating, the thing is, now we come to apply a tape on somebody on the couch, and how the tape should be applied. If you are treating with the weak muscles, and you are dealing with weakness problem, then the tape should always be done from origin to insertion, right? If you want to inhibit, if you have an overactive muscle and you want to inhibit muscle activity, like if you have a tight muscle, like if you have a tight pecs, if you have a tight trapezius, because that will be overactive, isn't it? So what happens is, you always try to do it from insertion to origin. So just altering the tape, chipkana kaise hai? How do we stick the tape on? Because we have to stick on one side and then we have to fix it. Either we go from top to down or down to top. So say if you have a deltoid, if you want to reduce deltoid activity, then you go from down to top. If you want to improve the strength, then you go from top to down. So that's how you stick the tape on. That is basic concept. If you understand this, any muscle you assess, you put the tape in the right direction. Let's say if you have to reduce the muscle activity and you put the tape in the wrong direction, you further reduce it. So it is very important that you understand this concept. Now the techniques. How do we, what kind of techniques? Because this tape is quite stretchable, So, what kind of techniques do you use? If you understand these basic techniques, then hopefully things will be fine. So, one is muscle technique. So, what happens is in a muscle technique, there is no tension on the tape,
बहुत लंबी
but the muscle will be on the stretch, right? So if you want anterior fibers of deltoid, what will happen? I will stretch the deltoid, but then I will put the tape on without any stretch. That is called a simple muscle technique, right? If you are having a ligament technique when you have some ligament tear, like you have in a knee, commonly if you have MCL or LCL tear, so you apply the full stretch from 75 to 100% of stretch on the tape. That is a very strong technique. So there will be, the ligament will be in a position where it's comfortable, yeah, and you apply the full stretch on the tape. The next one is, किसी को याद है कुछ क्या? Can anybody tell me?
ligament technique. Ligament.
कौन सा हो सकता है? Lymphatic technique. Lymphatic technique is when you have to reduce the swelling, right? So say somebody have some swelling in their arm or their ankle, so you put it in a fan shape. I will show you how to cut the strips and how to put it on. So you can use for swelling, you can use the fan technique, and also you can have a correction technique. In correction technique, if you have a misalignment, like say if your scapula is protracted or retracted, or it's downwards, yeah, compressed, or is elevated, so it is the correction, it's a postural problem. Or in the knee, the common example is your patella. If your patella is slightly lateral, so you have to bring it medial, you correct it, isn't it? If your patella is slightly lateral, you want to bring it medial. If it's medial, you want to bring it lateral. If it's slightly up, you want to bring it down. If it's slightly down, you want to bring it up. Yes? So that's a very basic technique you can use to correct the posture or correction. So when you assess the area, when you do an assessment, then you should have a very good fair play and a very good strong justification for your techniques. Which kind of technique I will use, which will improve my outcome. Because believe me, it does work. Because if you do the things in the right direction, if you just put this tape on and hope for the best, okay, I just learned this tape, I will put some tape on the shoulder and I will do this and that will never work. But if you clinically reason, if you do the proper assessment, is it this muscle, is it supraspinatus tendonitis, or is it infraspinatus tendonitis, or is it acromioclavicular gland, where I want to put a tape on, then believe me, it works. But you have to use it properly, thorough assessment and justification. So these are the 4 basic techniques in any assessment of the sports injuries, musculoskeletal problem. Which one are they? कौन सी बताएं बड़ा? First of one, कौन सी पहले वाली? Muscle technique. Second,
ligament
technique. The tape is on 75 to 100% stretch. And third, lymphatic technique. Fourth,
correctional
swelling. And fourth, correction technique. When you want to correct something, so the tape is stretched from 50 to 75%. So it's not fully stretched. Okay? And there are one more they call it, is called trigger point technique, where you apply full stretch. We will just do a trapezius trigger point taping. I'll show you in a minute. So if you remember all this, that should be enough on your level. Right. That is the more important slide. Contraindications. When not to put the tape on. If somebody have active cancer in the area, so you're not going to put a tape on, because what can happen, you can propagate that cancer and spread to the other areas. So you should be very careful for active cancer in there. if somebody have a fragile skin, like you may have seen in the elderly people, the skin is very fragile, and then it's more prone to damage. They can easily have allergy to the tape, so you will be careful not to put the tape in there. They say healing tissue, so if you have a wound, so you're not going to put directly over the wound, but you can put the tape near to the wound, surrounding areas, to increase blood flow to the nearby area, and that will translate into wound healing. So you can also use this for wound healing. Don't put directly on the wound, but somewhere around near, you can put the tape on, and that will bring all the stuff to the near to the area, and that will improve your healing. So also DVT is the other important thing. So you must be very careful. You're not going to put in a DVT patient because you can easily dislodge that DVT that can go and block their brain or their heart or wherever it goes. It is very dangerous. So you need to be very careful. Somebody with, because you will see a lot of patients with hamstring